Welcome back to Fox News at 4. Not all medication is easy to come by, especially for those who have, they need specialty care when they're at home. Here to talk more about infusion pharmacy services is Ashley Burt. She's with Infirmary Health. And Ashley, thank you first for coming out and sharing information on this. We were talking briefly about what specialty medication is. Can you elaborate on that for people who are watching? They're just kind of raising the one eyebrow. What is that?
Yeah, sure. So specialty medications are usually higher cost medications that are used to treat more complex disease states, like just a few examples are cancer, breast cancer, prostate cancer, rheumatoid arthritis, Crohn's disease. They just take a lot more monitoring than your basic, blood pressure medication. And they do have to go through a designated specialty pharmacy, which is what we are able to offer through Infirmary Health.
Okay, if you could go back to that, you can't necessarily fill it at your local pharmacy, you're saying?
Correct.
Okay.
They are a higher cost medication, and they do require a lot more upfront education, and the prior authorizations that are required by insurance just go a lot more into detail about what the patients have tried and what their diagnoses are and different things like that. So maybe specific labs that have to be done prior to starting the medication. They just take a lot more upfront to get the medication started for the patient.
And I know it's important to talk about the patient, but we have to bring in the providers too. What services are offered for them?
So we actually, within our Infirmary Health, we have 7 clinic-based pharmacists and a clinic-based pharmacy technician as well. And then we have a dispensing pharmacist that dispenses all of the specialty medications. And so with those 7 clinic-based pharmacists, we are in rheumatology, gastroenterology, and oncology amongst different, I think we service at least 10 different providers specifically. And we're just able to work with those providers on just starting the right medication for the patient. We do help go through that lengthy prior authorization process. We ensure that the lab monitoring that is required by insurance or just required by the drug in general is done up front. Then we're able to also just make sure that their patients get the meds, because that's the most important thing.
Right.
When we started our program, that was the biggest thing is the physicians were like, I just want my patients to get the medications. And that's where we saw a lot of a fall through and a big need for the services we offer.
I heard you say insurance and my ears perked up, because we have to talk about the insurance plans and the costs.
Yeah. So we do cover Medicare, almost all Medicare plans we're able to service for. Medicaid, we can do TRICARE, Express Scripts as well. And then we cover a wide variety of commercial plans also. Okay.
We are just about out of time. Is there anything else you want to add to make sure, people have all the information they need?
I guess the biggest thing is if you are with Infirmary Health and you are one of our providers, just make sure that if they don't, tell you about the pharmacy service that's offered, you can always ask for it. Always reach out to your local pharmacist, whether you have a specialty medication or not. We're just a great clinical resource for you.
I'm glad that you said that. Ask. I had someone tell me there is no such thing as a dumb question, and that is true.
That's correct.
Ask. Yeah. The only dumb question is the one that you don't ask.
That's right.
Thank you for stopping by and sharing.
Thank you so much for having us.